thanks for all the speakers for their informative talks in the last session. My question is for Dr. Arwa. Regarding the changes in the regulations in terms of donor deferral, and we noticed during the pandemic, as you mentioned, things have been settled for tens of years and suddenly they changed. So what do you think about the process of keeping or removing or changing the deferral period as what happened in the pandemic? Why didn't happen before? Why it hasn't been considered? Was it logic to be kept, but the pandemic changed everything? Or how do you look at these changes?
Really?
Yeah. Thank you very much. This is a very good question. I think we were driven actually by the changes in the deferral criteria by what WHO tells us to do. So WHO have created actually a group of experts to review the recommendations for the blood bank and transfusion services, not only with regards to donation, but also with regards to CCP. And if you review these documents that were updated regularly by WHO, you could see that initially, because we didn't know much about COVID-19, it wasn't like the normal coronaviruses that we have experienced in the past. It was very fatal at the beginning. People were transmitting the virus very quickly, and we didn't have any data about, what type of mortality that we're talking about. Is it something that is transfusion transmissible or not? So the criteria at the beginning, and as I mentioned with the dengue, is the same thing, is that you have to defer for the double of the potential incubation period for anyone who is asymptomatic. So if your incubation period is about 7 days, then you would do double of that. But for COVID, they even did more than that by 28 days to start up with, because we didn't have any data and we didn't have any information. And then once the pathogen, they managed to find the molecular genotype of the COVID virus itself, and that basically helped in decreasing the deferral criteria. Vaccination also played a role. So the type of vaccines that appeared in the market were diverse. Some of them were live attenuating vaccines, some of them were not live attenuating vaccines, and the availability of these vaccines globally were very heterogeneous. And as a result of that, WHO had to put in recommendations for different types of vaccines differently. But it was going through a regular process of review of the literature that was emerging with time and with input from a multidisciplinary team of experts in WHO. And I think the latest version of the recommendation is yet to be updated because if you see the last version, it was literally toward the end of the pandemic saying that there is no benefit of collecting CCP, we should not anymore collect it. This is what you have to do with the donation for donors, and it's a 7 days now deferral criteria. And for vaccinations also, it's very clearly defined. But for CCP, I think we need to close that loop because we need to understand, are we going to collect CCP and bother with that or not? Thanks.
Mr. Abdullah.
My question to Dr. Arwa regarding the dengue virus screening you initiated in Oman. You showed that it was actually outbreak in the Sib area, and then you stopped actually collecting blood from that area if they were there for 28 days. So how did you manage to provide blood to these areas? Because we have actually, dengue is relatively common in our Saudi Arabia, especially in the coast areas. But so far, we actually haven't got any sort of national consensus on what we should do about testing or donor deferral. Only deferring donors who had a confirmed dengue infection that will be deferred. But other than that, we don't have any, actually currently anything. So what do you recommend and how you dealt with that situation?
Thank you very much for the question. So dengue was a challenge for us because we did not know much about the epidemiology. It was really small focus outbreaks areas that we were seeing, and it was very localized. Until what we saw in 2022, whereby it impacted other areas in Muscat other than the Seep area, which was previously had the vector being detected. And we think that the reason behind that is people migration. People do move. Muscat is a very small city, so people do move very quickly, and with that, potentially the vector have distributed. And it is now undetectable, so we don't have dengue cases for the past a year and a half to 2 years. And I think this is all have happened because of the early governmental action from the Ministry of Health as well as from the municipality of Muscat in controlling the vectors and in educating the public on how to prevent the vector migration, keeping the place dry and try and mitigate that. Oman climate is also changing with time, and we are getting lots of changes in terms of temperatures as well as in rainfalls. So I think things are controlled now. But to answer your question, it was a huge challenge because our blood bank is literally in the middle of the area. I have detected the mosquito in my office. It was the first report of the mosquito in my office in the hospital, and it was, a public ID alert. And I took a photo of that and sent it to the ID, and I said, I have the mosquito in my office. So you can see, you can identify that, right? The thing is that it's just so challenging for you to what to do because whenever the Ministry of Health detects an area, they basically send in a recommendation saying, don't collect from this area, right? And then it moves to another area. Okay, expand your deferral to another area. And for us as a blood bank, it doesn't work that way because Muscat is small. We are literally within a 30-minute drive. If you keep deferring donors, first of all, you don't really know what you are deferring because donors could be working in a place and they are living in another place. And this is why the Ministry of Health at the beginning had to instate NAT testing because it was impractical. What we did as a blood bank initially, because under the university, is that we initially shifted our donation camps to areas that were not impacted by dengue, so far from a SEEB area. It was a lot of work for us because you are establishing new agreements with new institutions, with new malls, with new mosques. It happened during Ramadan, so we had to move our mosque donation campaigns to another areas. And we also tried our best to educate the public on why we are doing this. Because the public was also, similar to COVID, was fearful. Why you are rejecting us as blood donors because we live in this area. So it is a process of a mutual education to the public as well as agreement with institutions of action you have to do until you instate NAT testing. NAT testing is not a routine testing for countries that are having dengue. I have to admit that. But for us, we had taken recommendations from a colleague who actually live in North America, in the United States, and they had outbreaks of dengue in certain cities. And what they do is that when they have the outbreak, they start testing for NAT. When the outbreak is done, they stop testing for NAT. And with time, they had developed their epidemiological data that way. And so they understand that during these months of the year, we know that there will be a potential outbreak, and therefore we will initiate testing. But you're talking about a country that developed epidemiological data over time in comparison to a country that is starting to face this problem out of the blue after recovering from COVID. So the approach has to be local. And I think it is very important that you also see as a country what other blood banks are doing, because it has to be national. When the Ministry of Health has instated it, we had no choice. You have to instate NAT testing. You know what I mean? So it is important to look at it as a national level and to agree on an action to be done.
Thank you, Dr.
Okay,
Mohammed, you have a question?
thank you, Dr. Ammar, and thanks for our distinguished speakers for their outstanding presentation. My question is to Dr. Karen. We learned this morning that low contribution of female in blood donation is a major concern for our Ministry of Health, and they have one of their strategic plan to increase their contribution in blood donation to encourage female to donate. And looking at the published data, almost 25% of female in Saudi are suffering from iron deficiency anemia. So I'm just a bit worried about pushing female or encouraging female to donate that will cause anemic or iron deficiency anemia. So what do you think of that? Is there any scheme or program to improve iron level for female in Saudi?
Is she online, Dr. Karen, or no? Is she online or no? No.
Okay, then. Okay, thank you so much.
It was a good question anyway. Any other question? Maybe there's not. I would like to thank you, Dr. Arwa, and to Dr. Karen for very nice talks, and wish you I'm sure the next talks will be also beautiful. So see you tomorrow, inshallah, for the next sessions. Thank you. Thank you.